Hey everybody, how you doing? Uncle Vinny here. You know what's coming up? That's right, Health Chat. Grab a cup of coffee, sit back, relax, and enjoy the show.
I'm Dr. Nick Circolone, and you're listening to Health Chat. Today, I specifically want to talk about carpal tunnel. Carpal tunnel affects a majority of people. If you use your hands, you probably have some carpal tunnel. I will tell you this. There's a test called an EMG, electromyography. And what that does is it checks for the speed of the nerve. It's called exoplasmic flow, and it's called the speed in that nerve. And from point A to point B. Now, when we see a slowing of that, it usually indicates that there is a compression of that nerve somewhere. Well, I would say 95% of the cases that we do an EMG on in the upper cervical, we will find that they have some sort of carpal tunnel. Does that mean they have symptoms of carpal tunnel? Does that mean that it's a surgery kind of related issue? No. What it means is that majority of the people have somewhat of a carpal tunnel. Usually it affects these three fingers, your thumb, your index finger, and your middle finger, and sometimes a little bit of your ring finger. Not everybody has the same symptoms. Some people have total hand numbness and tingling, which can be related part to carpal tunnel and part to something else. But specifically today, we're going to be talking about the three fingers. That's the median nerve that affects that area. And some people will wake up in the middle of the night and go, oh, my hands feel so numb. My whole arm feels like it's tingling and falling asleep. Well, these are the things that we're going to talk about today. It's a short, simple explanation for it, but it'll make a lot of sense. A lot of times it's not a true carpal tunnel where we have compression around the retinaculum of the wrist, but it's more of a repetitive strain type injury. For those of you old enough to remember when we first started hearing about carpal tunnel in the workplace, we started seeing changes in the way we had our desks and our workplaces modified ergonomically to fix some of this. If you're probably old enough to remember the bent keyboards or the pillow type mouse covers when we were using mouse pads and things like that. These were all designed to help decrease pressure around that retinaculum and decrease pressure of the forearm, which can cause repetitive strain injury. Now, repetitive strain injury usually occurs from the elbow down to the wrist. A lot of times you'll see that the wrist is extremely sensitive and painful, but the problem is upper forearm and closer to the elbow, those muscles up there. There's a muscle called the pronator teres, and you have a supinator muscle which rotates it up. So your hand rotates back and forth. So the palm up is supination, the palm down is pronation. So these muscles right here can affect that median nerve, giving you the same symptoms as carpal tunnel. So what do you do for that? We have 27 bones in the hand. We have an ulna and we have a radius and we have a humerus. But the ulnar and the radius can be adjusted just like every other bone in the body. The hand can be adjusted. So when you come into the office and we find out that, hey, you have some carpal tunnel symptoms, maybe not a carpal tunnel directly, but carpal tunnel symptoms, we evaluate that and we find out, is it carpal tunnel true or is it more of a repetitive strain injury? And I will tell you this, majority of the time, it's repetitive strain. So that's a fixable thing. If you have thumb soreness, that could be related, not carpal tunnel, but to repetitive strain. So what we do is we'll work on the forearm muscles, we'll work on the ulna and the radius, and we'll adjust the wrist as well. And a lot of people, their symptoms go away. Now, once we adjust you, does that mean that you will never have symptoms again? No. What that means is that we found the problem, we've corrected the problem. Now it is your job to use the exercises that I give you specifically for those repetitive strain type movements to decrease that pain. Once we decrease that pain, once we decrease that tension, the symptoms will go away. Now, if the symptoms reoccur, sometimes we have to stop that motion that keeps aggravating that for a period of time. Now, You've heard of epicondylitis. That's median or lateral epicondylitis. You've heard of golfer's elbow, tennis elbow, all the same thing. What happens is if you get lateral aspect or lateral epicondylitis, you will have symptoms down into the 3 fingers that we talked about earlier. So what we have to do is we have to evaluate the elbow as well as the forearm musculature to make sure we don't have compression of that nerve in that area. Again, a lot of people think that, oh, I'm going to need surgery once I have carpal tunnel. No, that's not the case. Statistically, 90% of my patients that come into my office with numbness or a carpal tunnel-like symptom, we can get rid of that in 90% of the cases without surgery. Now, that's pretty darn good. And that's without doing injections in the area. That's without bracing. That's just with manipulative therapy. Think about that. 90% of the cases are getting better through manipulative therapy. Now, this is the statistics I see in my office. Some people may get the same statistics or less in theirs, but I know that we get about 90% are better after we work on that area. And the key is, once we get the pain and the irritation off that nerve, and we get function back into the joints, and we get function back into the hand, if we do those exercises, the chances of it coming back are lessened considerably because you're doing those exercises at home. Now, there are some people that it affects them when they sleep. Sometimes I'll go to sleep and I'll wake up because I sleep like this, and my hands are numb and tingling. Once I get up, once I'm moving around, it goes away. That's not carpal tunnel syndrome. That's just because I compress those areas. And a lot of us have that same problem. So when you come into the office, we want to make sure it is truly caused by the wrist or the forearm, that area that we're going to evaluate to make sure that those carpal tunnel symptoms are in the extremity. We'll also look at the cervical spine. We'll look at the shoulder because sometimes you'll get those same types of pain caused from a disc or a rotator cuff irritation. So these are things that we'll look at as well. But for today, we're just talking about working from the wrist to the elbow, that and in between, of course, and the hands and the fingers. So think about this. If you're suffering from hand pain, if you're suffering from numbness and tingling, don't let it go. I have had patients come into the office that have had this same type of symptomatology for weeks, months, even years. The longer you wait, the worse it is. If you let it go too long, you can damage the nerve and cause a different type of problem that may not be able to be fixed through manipulative therapy. So, if you have chronic pain, if you have acute pain, get those things checked out. Do not let this linger because you can get damage to those areas. Guys, have a great week. We love you and have a great day, and we'll see you next week.